Let us discuss about the nosocomial infection. Nosocomial infection is also called as healthcare associated infection or hospital acquired infection. If anything they ask for you means you have to write about the nosocomial infection. Nosocomial infection is nothing but called as the hospital acquired infection or healthcare associated infection. Healthcare associated. In the name itself it is saying that healthcare associated. When the healthcare people, for example doctors, nurses, are taking care of a particular person or particular patient with that same hands or unclean hands or unhygienic hands, if he goes and attends to the next patient, there is a chances of getting transmission of the first patient's disease condition to the next patient, because the healthcare person, the person is getting treated in the hospital. Healthcare nosocomial infection is nothing but when the person is getting treatment in the hospital, during the procedure or during the treatment. Nosocomial infection transmits from person to person or to the another person while carrying out medical procedures and treatment. That is called as nosocomial infection. But risk factors for the nosocomial infections. Risk factors for the nosocomial infections. Risk factor for this nosocomial infections are ill person, immunity suppressed person or immunity less person, infected person, immunity less person and infected person. Mostly these three are the risk factors. Risk factors are nothing but those who are susceptible to get infection. Those are called as risk factors. Who are on the at risk to get the infection? Ill person, because he is already ill. There is a chances of getting more infections to this person because his immunity power is less, or because he is on medication or some therapeutic diet. So there is a chances of getting further infections by the healthcare workers. And immunity less people, those who are having less immunity power. I hope you got what do you mean by immunity, right? What do you mean by immunity? The power of fighting against the infections. Simple word, the power of fighting against the infections. And infected person, for example surgical wound, LSCS done and the person has come to the post-operative ward, and within 3 days we have to change the surgical dressing. But unfortunately, if we do the surgical dressing without having hand wash and practicing the surgical asepsis, what happens? There is a chances of getting infection to that surgical wound. There is a chance of getting an infection to that surgical wound. What do you mean by surgical wound? If any person gets injured, that is called as wound. But surgical wound I am saying means an incision, surgical incision, or an incision after a operation, that is called as surgical wound. Surgical wound is always sterile wound until unless it gets infected. Understood this much? So here the transmission of nosocomial infection. Transmission word means spreading from one person to another person. That is called as transmission. So here there are mainly two types of transmissions we can see here. Direct transmission and indirect transmission. Direct, in the name itself it is saying that the direct contact to the person. Direct contact to the person. The nosocomial infection can be transmitted from person to person. That means patient to patient transmission. Okay. Patient to visitors, those who comes to see the patient, there is a chances of spreading nosocomial infection from patient to visitors. So staff to patient. When the healthcare persons are taking care of many patients, right? So there is a chances of carrying these transmissions from patient to patient by the channel of staff. This is all about direct transmission of nosocomial infection. If we come to this one, indirect transmission. Indirect. When we speak indirect, there is a vehicle or there is a person to help out these microorganisms to transmit from patient to the other person. Example, vector-borne disease. We already read in intermediate and 10th also, right? Vector means what? Some flies, bugs. Example, mosquitoes, flies. Especially flies only involves here. Mosquito that comes under the area and all. Here hospital acquired infections are different. So vectors, mostly the flies involves here to transmit the nosocomial infection from person to person. Next one is aerosol droplets. What do you mean by aerosol droplets? What do you mean by aerosol droplets? I explained you. That is the reason I am questioning you. Aerosol droplets is nothing but the infectious agents transmit by the help of the droplets. When we sneeze, cough, what is happening? Actually, what is happening? Some saliva or some nasal secretion comes out with that force, right? So these droplets can transmit the disease condition to the another person. That is called as aerosol droplets or droplet infection. This is an indirect transmission. Next one is contaminated instruments. Contaminated instruments. What do you mean by contaminated instruments and equipments? For example, LSS, lower cesarean section. Operation done and they took the baby out and stitches and put the person in a post-operative ward. 3 days completed and one healthcare person has come and changed the dressing. Surgical dressing has to be changed 3 days, after 3 days. So with that same hand, like unfortunately that person got the pus formation. Pus formation may be like because of the unsterilized equipments. What do you mean by unsterilized equipments? To do any operation, we used to use sterilized equipments. Sterilized equipments means the equipments are free from microorganisms. When we use unsterile equipments, there is a chances of getting infection, right? There is a chance of getting infection to that wound. So with that same wound instrument, whatever she used the instrument to clean, for example artery forceps, use that artery forceps, and with that same instruments, she's in hurry, she went and assist the another case. What is happening? This pus is having microorganisms, and these microorganisms can transmit from this infected person to the healthy person or healthy surgical wound person, and that wound also got pus formation. This is called as transmission by using the contaminated instruments or equipments. Okay, transmission of nosocomial infection is nothing but the passing of microorganisms from one person to the another person in the hospital setup. In the hospital setup, there are two types: direct transmission and indirect transmission. Direct transmission, patient to patient, and patient to visitors, and staff to patients. Indirect transmission is vectors, aerosol droplet or droplet infection are contaminated sites of nosocomial infection. Blood, lungs. The sites of nosocomial infections are blood, lungs, urine and surgical site infections. Blood. How these blood infections can be transmitted from one person to another person, as we already discussed you, contaminated. Contaminated. What do you mean by contaminated? Contaminated is nothing but infected with the microorganisms or infected by the infectious agents. It's called as contaminated. Okay, contaminated needles. You can write needles, instruments, contaminated needles, instruments and tubings. For example of this one is surgical procedures, operations. Mostly through the blood and blood products, only operations, during the operations only or surgical techniques only, there is a chances of transmitting the nosocomial infections through the blood channel. And coming to the lungs. How can this lungs nosocomial infection can happen? Aerosols, droplet infection only, right? Aerosol or droplet infection or droplet transmission. Infected droplets can transmit the nosocomial infection from person to the person. Next one is urine. Catheter, police catheter. Police catheter associated infections. What do you mean by police catheter? I already explained you that police catheter is nothing but a tube-like structure they insert into the urinary pathway or urethra. Urinary passing way to drain the urine. That is called as police catheter. Police is going inside into the bladder, right? The police is going inside into the bladder. When it is going inside, it should be sterile process. If we do without having hand wash, or if we do without wearing a surgical gloves, though we are inserting a sterile tube, but still without having hand wash, if we touch with the unsterile glove, that tube gets unsterile, right? There is a chances of getting contamination or attack of the microorganisms on this tube, and this tube is going into the part, one organ of a human body. Thus it causes the catheter associated infection. Not only that one. See, if in case that catheter has to stay for a long time also, there is a chances of getting catheter associated infections. Right? Next one is surgical wound. I already explained you. The surgical wound is nothing but the operation site. There is a chances of getting infection because from the staff or by using the infected instruments. By staff or by using the infected instruments. Right? These are all the sites of nosocomial infections.
Thank you for watching. Please like and subscribe, and I'll come up with the next video. Thank you.